Yeah, definitely not all 500 diseases have the same severity. Some of them are very severe. To name a few: severe combined immune deficiency, SCID, uh, severe forms of leukocyte adhesion deficiency, severe congenital neutropenia. So these are certain diseases which are so severe that if we pediatricians don't pick up them early, most patients die in the first 1 year or maximum 2 years of life. So these are universally fatal. SCID, the severe combined immune deficiency, is said to be a medical emergency because unless diagnosed and treated, 100% of patients die within the first 2 years. So those are the most severe immune deficiencies. Now, then the second subgroup, I would put it as, say, moderate kind of immune deficiencies. In some sense, because they present a bit later, these children start having problems usually beyond 2 or 3 years of age. They come to us with repeated chest infections and ear infections. The classical example here is X-linked agammaglobulinemia, and here these patients don't produce immunoglobulins. It is a protein that fights infections, and so we have to treat these patients by giving them back immunoglobulin injections. And then there are patients called C.V.I.D, the disease I was talking to you before, as common variable immunodeficiency. These patients often come in the second and third decade of their lives. So it is often adult patients who come to us with infections and autoimmunity, and they often suffer for years. They don't die, but they keep suffering for several years until a diagnosis is really established. And then there is a chunk of mild immune deficiencies wherein people keep suffering but get better with antibiotics. So, yes, this is a spectrum of diseases, and not all of them are very severe. I am a pediatric immunologist, so I am a pediatrician. So, most often I would end up seeing children in my practice, though I do see adult patients because there is nobody who really practices adult immunology. At least in Bangalore, or I think most places, we don't have adult immunologists. Most of them are rheumatologists who deal with autoimmune diseases and they don't deal with immune deficiencies. Now, let me give you a perspective. In India, majority of the patients that are getting diagnosed are children. It is just because adults are not getting diagnosed. It does not mean adults don't suffer. There are like thousands and thousands of patients in India who are not getting diagnosed. They, I think, are with the pulmonologist or the gastroenterologist or with the hematologist and getting treated without getting a diagnosis. Now, if you go to the Western literature, in the last decade, their literature says now close to 40% or sometimes close to 50% of their patients are adults. That is not the scenario in India. So, what it means is, as awareness increases, as adult physicians start diagnosing, more and more adults will start getting diagnosed with immune deficiency.